Do you ever find yourself overly stressed, tired, and even notice weight gain despite not changing your diet or your workout? Your cortisol level may be out of whack. More specifically, it may be too high. Cortisol is often called the primary stress hormone because it's one of the main hormones that we release when we're under any sort of pressure or on an evolutionary based fight or flight response. Although most of us think that cortisol is a bad thing, such as contributing to acne, weight gain, or high blood pressure, there's actually a lot more to cortisol levels than just our stress response and its unwanted symptoms. We need cortisol to live. While producing cortisol is necessary for life and it helps to keep us motivated, awake, and responsive to our environment, maintaining abnormally high circulating cortisol levels can become dangerous and it can contribute to long-term problems. The long-term use of corticosteroids and chronic stress are two of the biggest contributors to high cortisol. Chronic high cortisol production is tied to symptoms and ailments including weight gain, anxiety, sleep disorders, hormonal imbalances, fertility problems, in addition to many others. The good news is there's many natural ways to get your cortisol levels in check. For instance, adaptogenic herbs are known to lower cortisol, and that's just the tip of the iceberg. You can greatly help to manage cortisol levels and regain your health by changing your diet, your exercise routine, your sleep, and your stress levels, assuming you haven't been diagnosed with Cushing's disease by your doctor. Poorly managed blood sugar levels, especially hypoglycemia or having low blood sugar, and high levels of inflammation can contribute to high cortisol levels and other hormonal imbalances. Following an anti-inflammatory diet low in processed foods and high in antioxidants, fiber and essential nutrients are key to balancing hormones, controlling your cravings and getting you on the right track. These same strategies can also help with adrenal support, allowing you to reach and to maintain a healthy weight, boosting your energy during the day and helping you to sleep better at night. Some of the most significant dietary contributors to inflammation and high cortisol levels include high sugar, a high glycemic diet, with many packaged foods, refined grain products, sugary drinks and snacks, consuming high amounts of refined and trans fats, drinking too much caffeine and alcohol, experience insufficient intake of micronutrients and antioxidants, not consuming enough fiber, which makes it hard to balance the blood sugar, and not consuming enough healthy fats or protein, which can lead to hunger, weight gain, and high blood sugar. Instead, switch to a low glycemic diet, including healthy fats and proteins with every meal, and make sure that you eat enough fiber and phytonutrients by eating plenty of fruit and vegetables. Some of the most useful foods for lowering cortisol and stabilizing blood sugar include vegetables, fruits, coconut or olive oil, nuts, seeds, lean proteins like eggs, fish, and grass-fed beef, and probiotic foods like yogurt, kefir, or cultured vegetables. Chronic stress is now linked with just about every health problem out there. Stress affects most people at least to some degree, and it impacts health by sending chemical signals around the body, including to the heart and the blood vessels, the immune system, the lungs, digestive system, sensory organs, and the brain. Stress has the power to increase breathing, heart rate, pain, and muscle tension, your appetite, including overeating, and sleep-related problems. Fortunately, stress management is something that you can begin without too much trouble. Natural stress relievers are proven to help to lower cortisol and decrease the negative impacts of stress on your health. Meditation or mindfulness has been shown to help to train the brain and the body to turn off the stress response and to promote more relaxation, and these benefits are possible without impairing alertness, concentration, or memory. Many studies show daily meditation or even healing prayer for just 15 to 30 minutes can offer significant reductions in cortisol. Participating in regular mindful-based stress reduction programs also offers a significant reduction in cortisol and stress-related symptoms or diseases. You can use meditative methods to improve brain and heart health while bolstering your immune system. Acupuncture has been trusted for thousands of years in traditional Chinese medicine, and the treatments can help to naturally control stress and reduce symptoms like muscle or joint pain, headaches, fertility problems, trouble sleeping, and poor circulation. Taking deep breaths helps to turn down the sympathetic nervous system and kick in the body's natural relaxation response by activating the parasympathetic nervous system. Diaphragmatic breathing is an easy technique to learn on your own, with practice every day, to relieve muscle tension and anxiety. Controlled breathing techniques have been a staple in Eastern health practices for centuries, and they're becoming more popular in the West, thanks to the emerging studies and books describing their benefits. Studies show that physical setting plays a role in stress reduction, and being in nature is a well-documented way to promote relaxation. Try going for walks or runs outside, especially barefoot running or walking, a practice called earthing. Spending time near the ocean, walking through forests, gardening at home, or doing other things outdoors and away from technology to reduce anxiety. According to research published by Harvard Medical School, regular exercise, about 30 to 60 minutes most days of the week, depending on the intensity, is one of the best ways to manage stress, to balance hormones, sleep better, and aid normal metabolic functions, like balancing blood sugar levels. The key is to avoid overtraining and overexerting yourself, which can actually cause even more cortisol to be released. Exercise benefits hormone levels because although it temporarily increases adrenaline and cortisol production, it generally helps to bring it back down to normal levels afterwards. This cycle helps your body to better handle stress and gives your autonomic nervous system, the one that controls your stress and relaxation response, its own workout. This means the next time that your stress hormones rise due to a perceived threat, you should be able to lower the cortisol levels more easily, since your body has become primed for this during the physical activity. Adaptogenic herbs help to naturally lower high cortisol levels in several ways. They help to balance hormones, reduce inflammation due to their strong antioxidant, antiviral, and antibacterial effects. They have natural antidepressant effects. They lower fatigue, and they help to balance blood pressure and blood sugar. Many adaptogens like reishi mushrooms and cacao have been safely used for thousands of years to promote better overall health with little to no side effects. There's at least 16 different proven adaptogenic herbs that can help to lower cortisol, including ashwagandha, astragalus, licorice root, holy basil, medicinal mushrooms like reishi and cordyceps, and rhodiola. Similarly to adaptogenic herbs, essential oils are also helpful for fighting stress and balancing hormones. Essential oils include lavender, myrrh, frankincense, and bergamot. They contain potent active ingredients, and they've been shown to naturally lower cortisol, reduce inflammation, improve immunity, and help with sleep and digestive function. You could try inhaling some of the best essential oils for hormones, diffusing them in your home, making bath soaks and body washes, rubbing them directly into your skin when mixed properly with a carrier oil like coconut or jojoba oil. If you're dealing with side effects of high cortisol, including acne, indigestion, or bloated stomach, certain essential oils like lemon or peppermint can also help here. Getting enough sleep helps us to control cortisol production, but having high cortisol levels can make it hard to sleep. In people with normal circadian rhythms, cortisol levels rise during the early morning hours, then they drop very low at night prior to sleep and during sleep. People who develop high cortisol levels can wind up feeling the opposite, wired and anxious at night, but then fatigued during the day. Thus, they can't sleep well. This overactivity of the adrenal gland is one of the biggest signs of Cushing's disease or adrenal fatigue, and it's usually tied to stress and hormonal imbalances. By taking the steps listed above, you should be able to rest more easily. Ideally, you should aim for 7 to 9 hours of sleep per night to reset your circadian rhythm and bring the hormones back to balance. You could check out my videos on herbs to help you sleep and my video on melatonin for more helpful tips. The adrenal gland, following signals from the hypothalamus and the pituitary gland, is responsible for the secretion of cortisol, a type of essential glucocorticoid steroid hormone. Cortisol levels are highest in the morning, around 7 a.m., and lowest at night. This is called a diurnal rhythm. Cortisol is also present in both chronically stressed individuals and those who are perfectly healthy. This vital hormone possesses dozens of different purposes within the body, and it makes numerous chemical interactions every single day. Cortisol receptors are scattered throughout the entire body, found in nearly every cell, and they serve different essential functions, including helping to keep us awake and alert, preventing fatigue or brain fog, keeping our metabolism running. It helps us to burn fat for energy, balancing blood sugar levels, since it allows cells to take up and use glucose for energy, reducing inflammation and helping with healing, balancing fluid levels based on salt and water intake, contributing to control over blood pressure, helping with many cognitive processes like learning and memory formulation, allowing us to respond and to escape perceived dangers, and helping to develop the fetus during pregnancy. Levels of cortisol rise when the pituitary gland releases another hormone called adrenocorticotropic hormone. This signals the adrenals to pump out more cortisol. Why does this happen? Many different things can trigger the release, including various forms of physical or emotional stress, a poor lifestyle, too little sleep, or illness and infection. When the pituitary or the adrenal gland produces abnormally high levels of cortisol for a duration of time, a doctor, perhaps an endocrinologist, can diagnose a serious chronic disorder called Cushing's disease. Cushing's disease is usually caused by tumours on the adrenal or the pituitary gland, and it often causes symptoms like rapid weight gain, a swollen face, fatigue, and water retention or swelling around the abdomen and the upper back. It impacts women between the ages of 25 to 40 most often, although people of any age and gender can develop this condition. Diagnosable Cushing's disease caused by an overactive adrenal gland is considered much rarer than just having generally high cortisol levels. In other words, you have a much greater chance of experiencing high cortisol at certain times due to increased stress in your life than you do from ever being diagnosed with Cushing's disease. While people experience at least some high levels of cortisol at one time or another during very stressful episodes, like a job loss, family crisis, or major change, rates of Cushing's disease diagnosis are still very low compared to other hormone endocrine conditions like thyroid disorders or diabetes. It's estimated that Cushing's disease impacts between 10 to 15 people per million, but comparatively high cortisol levels above what's considered normal can affect millions of people and affects most adults. While symptoms of Cushing's disease and high cortisol tend to be similar, those caused by Cushing's disease are usually more severe, last longer, and they more often cause other complications. To clear up confusion about terminology, Cushing's syndrome is not the same as Cushing's disease. They're similar but also different conditions. Cushing syndrome is less serious, and it refers to the general state characterized by excessive levels of cortisol in the blood, while Cushing's disease is the condition caused by a pituitary tumor that secretes the hormone adrenocorticotropin hormone, which causes excessive cortisol. On the other hand, the opposite of having Cushing's disease, experiencing abnormally low cortisol levels, can result in a condition known as Addison's disease, adrenal insufficiency, or adrenal fatigue. Addison's disease is also rare, and it's considered a type of autoimmune disease, since it causes the immune system to attack the body. In this case, tissues within the adrenal glands themselves can become damaged and inflamed, and this alters how the adrenals produce hormones. Certain symptoms of Addison's disease are essentially the opposite symptoms of Cushing's disease, since they're caused by a deficit in cortisol rather than an excess. Addison's symptoms can include fatigue, weight loss, muscle wasting, mood swings, and changes to the skin. Symptoms of adrenal fatigue can be similar. According to research done by the Genetic Learning Science Center, the long-term dangers of having high cortisol is that it activates the fight or the flight response, and this temporarily shuts down normal reproductive, digestive, and immune functions. The body targets these systems for shutdown because it doesn't need them for the immediate survival. Sensory nerve cells pass the perception of a threat or a stress from the environment to the hypothalamus in the brain. This signals the pituitary or the primary adrenal glands to produce more cortisol. If this cycle goes on for too long, someone becomes more susceptible to all sorts of illnesses, infections, and hormonal problems. Some clues that may signal that you're living with high cortisol include weight gain, especially around the abdomen or the stomach. This can happen despite not changing your diet or your exercise routine. A puffy or flushed face, mood swings and increased anxiety, fatigue, including feeling tired but wired, and trouble sleeping normally. Irregular periods and infertility problems. Chronic stress drives progesterone into conversion to cortisol. This competes for precursors available for synthesizing other important hormones like DHEA, estrogen, and estradiol. This is known as the progesterone-pregnenolone steal effect. High blood pressure levels. The cortisol narrows the arteries, while epinephrine increases heart rate. Acne and other changes in the skin can occur. There can be higher rates of bone fractures and osteoporosis, as cortisol can lower hormones like estrogen, which are important for bone health. There can be muscle aches and pains, changes in libido due to changes in estrogen or decreased testosterone, excessive thirst, increased urination, and higher susceptibility to infections. Cortisol tends to go up as a perceived stress goes up, so anything that triggers a negative mind state, things like anxiety, worry, anger, or frustration, contribute to high cortisol levels. Medication use, inflammation, poor sleep, and poor diet can also trigger high cortisol levels by altering hormonal balances and negatively affecting the immune system. Corticosteroid medications like hydrocortisone, prednisone pills, or other medications used to treat inflammatory-related diseases or symptoms are common causes of high cortisol levels. Aside from corticosteroids, other major factors contributing to higher than normal cortisol production can include depression, over-exercising or overtraining, nutrient deficiencies, addiction to alcohol or drug abuse, higher than normal estrogen levels, malnourishment and eating disorders, severe kidney or liver disease, hyperthyroidism, obesity, pregnancy or birth control pills, recent surgery, illness, injury, or whole body infections, which all trigger inflammation. Your doctor can order a number of tests to determine if you have abnormally high cortisol levels. Both blood and urine testing help to reveal a problem, but a 24-hour urine test is used most often, rather than a cortisol blood test to diagnose Cushing's disease or Cushing's syndrome. Keep in mind that values differ depending on the time of the day, your age, and the type of cortisol tests performed. Saliva tests are now also recommended, and they appear to be as reliable as a blood sample. Additionally, an overnight dexamethasone suppression test may also be recommended, and it involves taking a dose of a corticosteroid medicine called dexamethasone to determine how the blood cortisol level is affected. Because of this, your doctor will always need to evaluate your results in light of your specific symptoms and your medical history. Normal cortisol ranges for adults and children in the morning are between 5 and 23 micrograms per deciliter, or 138 to 635 nanomoles per liter. Normal cortisol ranges for adults and children in the afternoon are between 16 micrograms per deciliter, or 83 to 441 nanomoles per liter. And normal cortisol for a newborn baby is between 2 to 11 micrograms per deciliter, or 55 to 304 nanomoles per liter. If your test results reveal that you're at risk for Cushing's disease or Cushing's syndrome, you'll be treated depending on what's causing the cortisol levels to rise in the first place. Cushing's syndrome and Cushing's disease are most often caused by a benign tumor growth on the pituitary gland called a pituitary adenoma. Cortisol-like synthetic medication use and cortisol-increasing lifestyle factors can also be addressed. A high percentage of people with either Cushing's disease or syndrome display at least a small tumor growth on the pituitary gland and need to have these removed with surgery or reduced with medications and lifestyle changes in order to resolve the cortisol-related symptoms. It's important to talk to your doctor if you suspect you might have Cushing's disease or syndrome to assess whether or not you need to discontinue or lower your medication that could increase the cortisol, like steroids, undergo life-saving surgery to remove a tumour, or use radiation or medications to shrink the tumour. However, keep in mind these are very rare. Most people with high cortisol levels are able to manage their condition naturally without any surgery or medication. Although cortisol is often viewed as a bad actor, we need cortisol to live. The problem is medications, a lack of exercise, processed foods, and high stress levels can leave us living with too much cortisol in the body. In rare cases, usually a benign tumour could be the cause of a high cortisol. Your doctor can order routine tests to determine your cortisol level and suggest ways to help to lower it. Regardless, we could all probably tap into natural cortisol lowering techniques like mindfulness meditation, exercise, and a diet rich in fresh vegetables, clean protein, and fruit in order to keep the cortisol levels in check. Some steps that you can take to manage your cortisol levels include switching to a whole food, anti-inflammatory diet, reduce and manage stress, exercise regularly, use adaptogenic herbs and superfoods, use essential oils to promote relaxation and get enough sleep. You have a much greater chance of experiencing high cortisol at certain times due to increased stress in your life than you do of ever being diagnosed with Cushing's disease. Though Cushing's disease is usually caused by tumours on the adrenal or pituitary gland, and often causes symptoms like rapid weight gain, a swollen face, fatigue, and water retention or swelling around the abdomen and the upper back. It impacts women between the ages of 25 to 40 the most, although people of any age or gender could develop this condition. While symptoms of Cushing's disease and high cortisol tend to be similar, those caused by Cushing's disease are usually more severe, last longer, and more often cause other complications. Symptoms of high cortisol levels include weight gain, a puffy, flushed face, mood swings, increased anxiety, fatigue, trouble sleeping, irregular periods and fertility problems, high blood pressure, acne, and other changes in the skin, higher rates for bone fractures and osteoporosis, muscle aches and pains, changes in libido due to changes in estrogen or decreased testosterone, excessive thirst, increased urination, and high susceptibility to infections. Corticosteroids, depression, over-exercising or overtraining, nutrient deficiencies, alcohol or drug abuse, higher than normal estrogen levels, malnourishment and eating disorders, severe kidney or liver disease, hyperthyroidism, obesity, pregnancy or birth control pills, and recent surgery, illness, injury, and whole body infections can all cause high cortisol levels. For more information about herbs, supplements, and natural treatment plans, check out my website.